Faith Dialogue, a public affairs program at the crossroads of religion and life, a series highlighting the cultural and social interaction between the worshiping and religious communities in and around the capital city. Austin Faith Dialogue is brought to you by the Austin Metropolitan Ministries in cooperation with KTVC. Join us now in Austin Faith Dialogue.
Since the beginning of the 1980s, the rapid spread of acquired immune deficiency syndrome, better known as AIDS, has sent a shock through the human community. Helping professionals from physicians to counselors are struggling with ways to care for persons with this disease for which no cure has been found. The fear of contracting the disease paralyzed some. People who were otherwise sensitive and compassionate recoiled at helping people with AIDS. The religious community has not been guiltless. Alternately slow or brash in its response, the religious community has come face to face with AIDS and can no longer avoid it or make superficial decisions concerning it. The community must discover an appropriate way to respond to the disease and answer its critics. Critics who say that religion has in many cases helped propel the ignorance and fear, as well as the judgmental ways in which those with the illness have been addressed. Hello, I'm Valerie Bridgman Davis, Outreach Pastor of Sure Foundation Fellowship and your host for this edition of Austin Faith Dialogue. Today, my guests, Jean Hoper and Angela Omelagu, will help us consider how the religious community is now helping or hindering in the fight against AIDS. Ms. Hoper is a clinical consultant with Caremark, a private company which provides intravenous therapy to homebound patients. She has worked as a nurse with AIDS patients for the last 5 years. Ms. Omelagu is a caseworker, too, with the care unit of the Austin-Travis County Mental Health and Mental Retardation Department. CARE is an acronym for Community, AIDS, Resource, and Education. Welcome to you both.
Thank you.
It's good to have you both here. I said I wasn't going to do this, but I'm going to do it anyway, which is to say, how did you get into the care of AIDS patients, Jean?
I've spent the early part of my nursing professional career working with people with cancer, and as an oncology nurse specialist, work with people who are immune compromised. When AIDS first came into our awareness, and before we even had a name for it, physicians recognized that certain patients were unable to fight infection, and even though they didn't understand why, they put those patients on an oncology unit because the nurses there need to know how to take care of people who can't fight infection. Once AIDS, as we know it today, we understood what the disease was. For me, the issues were very parallel. With cancer, you have a disease frequently that's chronic. You need to deal with issues of chronicity, the quality of life, a life-limiting disease. They're exactly the same issues that people with AIDS confront. And so to me, it was a natural progression.
All right. And Angela, you work with the care unit, which is only about a year old now?
Approximately a year old.
About a year old. How did you go? You were working with MHMR in some other capacity. How did you get into the care unit?
Prior to working with CARE, I was still working with Austin-Travis County MHMR in a drug abuse program known as methadone maintenance, which is a program for intravenous drug users that has, in particular, opiate addiction. And it was a transition. I moved from that program to when AIDS came on the forefront, hearing about AIDS and intravenous drug users, the high risk that was, and with the education, I just moved into the CARE program after receiving a grant through the methadone maintenance program.
Getting people to take care of AIDS patients. I want to talk about that because it's my perception, and I may be wrong, that it's difficult to do. And if people do it, they don't tell people they're doing it. So tell me about what it's like for you to be a caregiver for someone with AIDS, either one of you, whoever wants to go first.
Well, as a caregiver of someone with AIDS, personally, it's a challenge because it involves so much. It involves trying to get a person to change, trying to get a person to, especially speaking of intravenous drug use, to come out of that denial and deal with something. Now is the time to change, and as a caregiver, that's difficult. And also, in your personal life, telling people about AIDS, there's still a lot of denial out there. talking to them about it, trying to get somebody as close as your family, to get them to talking about it, to realizing how serious the problem this is. And when you embrace that problem with your family, and they kind of resist and pull back, you can imagine once you go out into the community and try to face others, you get that same effect.
Mm-hmm. And what about it for you, Jean?
It's been an interesting progression for me. And one of the things that's most comical to me is that when I was speaking about before we knew what AIDS was, we took care of people who were HIV positive, people who had been exposed to the virus that causes the disease and never knew it, and were incapable then of discriminating or saying, not me, I don't need to do that. Then suddenly we learned what the disease is, and some members of healthcare, as other members, all members of society, elected or felt free to decline to provide care to those individuals. And the hypocrisy of that makes me crazy, simply because I can't understand playing that game. We've done it for years. Now that you know what it is, you're safer if you're concerned about yourself. And you recognize that the need for care is tremendous, if not overwhelming, to health care. And then to stand back and say, not me, I don't need to do that. I don't understand how people come to that conclusion. But that is out of my individual set of values and perhaps also my faith stance on who we are as people who claim to believe something. It is still very difficult to get folks to take care of people with AIDS, but I have to say that the medical community in Austin has made tremendous progress in that regard and has joined together so that there is now a group of physicians and we are able to make referrals and find people who will treat folks with AIDS with dignity that they deserve as any other human being on this earth.
Why do you think, you're talking about how difficult it is to get people to take care of AIDS patients. There have been other epidemics in this country. This is certainly not the first epidemic to threaten life as we know it in the U.S. Why do you think the AIDS epidemic is such a frightening thing for people? I talked earlier about people who are usually compassionate when it comes to AIDS, people who might have in the 50s or said to a polio victim, oh yes, I will take care of you, but now we have AIDS. Why do you think it is that it's that difficult for people with AIDS?
I have two ideas, and one thought is simply the reality that those of us active in healthcare now are part of the antibiotic, new tinker toys, let's do surgery and fix it generation. And we have lost that personal confrontation with diseases about which we know not what their cause is, nor do we know what to treat it. My generation is a generation of penicillin, and when third generation, fourth generation drugs, and you simply don't die of infections anymore. Even with cancer, to a large extent, it's a chronic illness, and it may be around for 12, 15 years. With AIDS, we have a disease for which there is no cure. And we have a generation of caregivers who have not had to confront that on a personal level. And so the one issue, I think, is an issue of experience and perhaps our growth and development as human beings. The other issue has to be the fact that AIDS, the discovery of the disease, came through people who were either IV drug users or homosexual. And so the disease has become linked with behaviors that many people either don't discuss or deny, and certainly protest that they have no part in any of those behaviors. And then we get into condemnation and look what they did it to themselves, they deserve it, and on and on and on down the line. And so I think we don't separate those issues.
And I agree with Gina as far as the denial goes, and then AIDS is something where you do have to look at lifestyles. And when you look at lifestyles, you're looking at people and personally, their personal life, things that we're, like she said, we're uncomfortable talking about. I don't talk about that. And if it is, it's in my home and not outside my home. And because it's that fear that, because it is a terminal illness, you bring out all kinds of fear because of the way people have confronted AIDS. It's being afraid and hands off and the rejection. It brings out so much fear and so many things that we thought that we were comfortable and talk about, and we could talk about it openly. and that this turned out not to be true, has shown that we're not comfortable talking about those things at all.
AIDS has shown us we're not comfortable talking about sex.
Amen.
Or, or any of the above. I want to talk about the guiltlessness of religious communities, whether it's a Christian community, Jewish community, whatever. And you may not feel qualified to talk about this, except that you have been trying, Angela, to get into particularly predominantly black Hispanic churches, the CARE unit has, to do AIDS resources and education. Would you talk about that, and what do you think is the problem with getting into churches?
Since September, when the program opened up in September of '88, we've been trying to get inside, particularly black and Hispanic churches, because that's how our grant was mandated, to reach blacks and Hispanics. We have had extreme difficulty. In fact, we've only been able to get into one church. The reason for that, I think, is a number of reasons. Again, as black and Hispanic people, we're not comfortable. It's not part of our culture to go out and ask for help. And then if I go out and ask you for help, I'm going to have to tell you about my personal life. And then it's with black men and Hispanic men, it's that machismo thing. No, this is my house, that's my lady, this is my family, and you are not going to tell me what I can and can't do with my family and my life. So again, that, you know, it's that denial, and then I don't know if it's part of it is keeping that identity, me being a man, and that's part of me being a man, to be able to make those types of decisions. And I think that's true in a lot of organizations, but that's also true in the church.
Well, I guess I'm still pushing here. With the church, for instance, I know of a minister in Austin who briefly mentioned AIDS across the pulpit. I mean, did not preach a sermon on it, just used it in an illustration. And after service was inundated by people saying, if you preach about that again, not even referring to AIDS, I will not be here. And so I can see ministers, rabbis, whatever, being really put on the line for faith, for one thing, how we treat people as God's people. And the other thing, the response of the people of God, the community of faith. Jean, you were going to say something about that?
I wanted to, if I can, for people, one thing that has been helpful in the past is to make a distinction, if you will, between the disease called AIDS and the behaviors that put one at risk for getting exposed to the disease called AIDS. In other words, we have, for many people, there is still an ultimate commingling as though the two are one and the same. And if we condemn promiscuous sexual behavior between consenting adults, and if we condemn homosexuality, and if we condemn IV drug users, then people make the jump to condemn those individuals who get ill with this disease called AIDS, and use that as justification for not reaching out to these people, be it with medical resources or be it with the support of a worshiping community. And for me, I think it's important to make a distinction. It is irrelevant to me what you do in your bedroom at night. I would guess that in the 15 years that I have been practicing as a professional nurse, I have taken care of a lot of people who had a broken leg from an auto accident or had cancer of the lung, who engaged in some pretty tacky behaviors over the course of their life. It was never relevant to my care of their broken leg that I know that, nor was it relevant that I pass judgment on the appropriateness of that behavior. The issue is that there is an individual who is sick and who requires assistance with the piece of their life. And I find it terribly hypocritical, or at least personally disturbing, that we now have a disease called AIDS, and that we with one brush stroke say, these people are unacceptable, these people are not deserving of our care and our support.
I read an article in the newspaper this past week that said that people are no longer, or fewer people, are changing their lifestyles because of the threat of AIDS, and fewer people are concerned about AIDS in the United States as they were, say, 5 years ago. You're caregivers, professionals at that, and I'm just curious to know how that stat hits you, Angela.
I'm not sure if that's true. I don't know where that study came from or where that information or stats came from. I don't think that's true. I think maybe I have noticed that in the homosexual community. I am not noticing that. I think that the heterosexual community is just now, maybe they're aware, they are the place where the homosexual community was in the mid-'70s or in the late '70s. Maybe they're not at the point where they are just afraid and they haven't seen death after death and dying of friends, one after the other. I think they are concerned. I just think it's a massive amount of fear and denial. I don't think that's true at all. I wouldn't agree with that at all.
One of the ways we cope as human beings is, if there is something that is ultimately the most maximum scary experience you can give me, then I will find ways to wall myself off from that and say that can't possibly happen to me. I think that is one way that the heterosexual world has protected itself from the fear of AIDS. I'm not gay and I don't do drugs, I don't have to worry. Forgetting the fact that you don't have to be gay and you don't have to do drugs to be exposed. They go to the other extreme and say, I cannot provide care to somebody with AIDS or be supportive of them, and I certainly don't want them worshiping in my church. My Lord, what if we share the common cup? That's not how you get AIDS. It takes a lot more effort than that. But by going to either extreme, it's an effort sometimes to protect ourselves and say that can't possibly happen to me. And it also is then a self-justification for the walling off that we do. If the stats in that study are correct, then that, to me, is very discouraging news. Because then that gives us permission again to stop talking about this disease and to stop confronting it as individuals and to not teach our children about safe sex and to not challenge our churches to respond to that educational need and our school system or wherever we feel it's appropriate that the challenge be placed.
Challenging our churches. You said, in passing, the common cup. And of course, quite a few communions do share the common cup. And I can just see viewers saying, oh no.
I never thought of that, oh no.
You mean somebody may have AIDS and sharing the cup with me.
But she's also said, you can't get the virus like that. That's not
how are we going to get them to hear the other part of that statement? But you can't get the virus that way. What can we do to help our communities of faith embrace all the people of God, even the ones with AIDS? Let's see if you can solve the world.
Go for it.
How do we get them to face, I mean, as Christians, we are to be God-like. And Jesus Christ taught and went around all sorts of people. He didn't limit himself. I think as Christians, we have to do the same thing. A person with AIDS or any type of illness that has reached out to me as a Christian, I have a duty and responsibility to reach out to that person and embrace him. I can't ignore him and call myself a Christian, no matter what he has and how he has gotten that disease. In the Christian community, I think it's okay to call sin, sin, and still embrace that person, to say you have sinned, we've all sinned, to call it that and still accept that person. He is now reaching out to me. And, you know, as a Christian, I have the responsibility, you know, not looking at how he became that way and why he's reaching out to me. That's not even important. He has reached out, and I have the responsibility to reach back.
You were going to say?
Again, to preface it, we respond, most of us, to AIDS on a visceral level. I mean, this isn't the intellectual tape that's playing in my head when I say I don't want any part of these people. It is the tape that's in our heart, that's in our gut. It's what our parents told us was proper behavior. It's what the church told us, whatever church we went to. And what I find is that people, as you said in your introduction, normally compassionate, caring, giving people do not respond to AIDS on a level of intellect. They respond at a gut level, and shun that which is frightening and scary and reminds them of the things that our moms and dads told us not to do. One of the ways to deal with that, and when I have gone to churches, and I'm perfectly straightforward, I warn them that I cheat, and normally do a series on AIDS in which we start with the ticky-tacky. What's the virus? What does it do to the body? How is it treated? Because that's safe. That's ever so safe. And at that point, then move into these other issues that are less safe. But we as educators, our difficulty is that we reach people in this program through the intellect. I am speaking to the intellect. And I do not believe, as much as I wish we could, that today we will change the heart or change that visceral reaction. I think that that is going to happen over time. And I also, when I get depressed, feel that that is going to happen as individuals see their friends get infected, see people they respect and esteem in their home, in their community, get sick with something that they came in contact with 7 years ago. Our typical experience is that somebody is exposed 5 to 7 years ago, and it takes that long for them to develop the symptoms of HIV in its full spectrum. And I think that's a piece of the fear, because I doubt that there's one of us today or anybody listening who didn't do something pretty dumb when they were young and growing up. And some of us get to outlive our goofs, and some of us pay a tremendous price. And 9 times out of 10, the individuals who are getting sick now are people who did something long ago in their life and maybe in a very different place right now and are paying the price.
I think you're very right. I mean, I'm dumbfounded that you're so right.
And I think something needs to add to that. You said they're paying a tremendous price, and not saying that AIDS is a disease that is God sent, that this is something God has sent to punish people. I think the Christian community really needs to get away from that and condemnation. We don't know. It's not God sent. As a result of what you did in your past, as a result of sin, this can happen. As a result of sin, a lot of things happen, and this is one of those things that you can become infected with the terminal illness.
So the one thing, if possible, that I would really like to challenge people of faith to do, regardless of the faith, is to find an environment within that faith structure where we can teach our children. We have known since certainly the early 80s how to stop this disease. There is no question. It's the same thing you do to prevent the spread of hepatitis. It's very simple. Blood and body fluid precautions. It's not a secret. But getting the message out and getting people to change their behavior. And it has always been taboo to talk about this in church, and I'm not suggesting that churches go out and say indiscriminate sexuality is wonderful. But what I am saying is that my children will not always be under my thumb. My children will not always have mommy's face in their face, and when they are making life choices that can be a threat to them, I hope they will choose a certain kind of sexuality, and I hope they will choose to be led by their faith in that. But if they are not, I do not want them to pay the price of getting infected with the virus that causes AIDS and dying as a result of it. And when we pass legislation that says only those organizations that do not condone illegal sexual behavior, which is anything except between married adults, only organizations that don't condone that or don't teach how to do that safely will have access to these funds. I think we set ourselves up as a society and we do ourselves a disfavor. And I would prefer that the churches take it out of legislation and say we are going to teach our young people. And we are going to do something about stopping this disease even while we care for those who are sick with it.
If you could sit down with your pastor and have him say, put in his mouth the words you would want him to say, Angela, what would you do? What would you say?
He may be listening. Be careful.
I know. What would I want him to say? That AIDS is just like any other illness or any other trauma that happens in your life, and that is a test of faith. And it's one of these things that you can deal with, and you can deal with it through faith in God. And I'm here to help you deal with that. I'm here for you.
Jean, I think you probably already did, but if you could say one thing to your pastor and have him say it, what would it be?
I would first remind him that there will always be those who will find the behavior of a pastor, be it man or woman, who ministers to those with AIDS. They will find that behavior unacceptable. And so I would advise my pastor to put on their lead suit and then go forth and challenge us to leave the condemning and the judging to the Lord, because the last I knew the Lord could handle that just fine. And to leave the ministry on earth to the people of God and lead us in the way to do that.
Angela, as we get ready to close, one of the things that you said brought to my mind, you said that if Jesus, we are called to be Christ-like, and if Jesus were here, he would embrace people with AIDS. And of course, many of the New Testament stories are about Jesus walking with lepers and being seen with known sinners and being seen with common prostitutes. And I think what you both have been saying to us this morning, perhaps better than I could ever sum this up, is that we too ought to be seen with the known sinners and the known prostitutes, and to live the way Jesus did. Well, I really appreciate you both being here.
Thank you
It's
for
been a
asking.
good conversation, and hopefully our viewers will think the same. I want to say a special thank you to both of you, Jean Hoper and to Angela Omeligu, for your helpful insights and for your theological insights. Pastors aren't the only ones with them, I guess. And also for our viewers for sharing this time with us. On behalf of the Austin Metropolitan Ministries, I'm Valerie Bridgman Davis, inviting you to be with us this time next week at the same place. Peace.